We can predict age from sleep. There are up to 80 different sleep disorders. Great advantage of wearables is that have a good sleep. This is very, very important. The evolution of the different sleep stages. I am Matteo Cesari. I am currently a postdoc at the Department of Neurology of the Medical University of Innsbruck, and I'm a biomedical engineer by training, and I've been studying in Padova in Italy for my bachelor in information engineering, started then the master in biomedical engineering and completed the master at the Technical University of Denmark in Copenhagen. And then after the PhD that I've been doing there, I'm here since 4.5 years in Innsbruck. My research interest is on making automatic methods for analysis, better analysis of sleep. In Sleep Lab, we record polysomnography. Polysomnography is a complex examination requiring a lot of expertise from clinical staff because they have to mount a lot of electrodes on the patients, and we collect during this polysomnography a lot of data. It's really complex data, and we are just scratching the surface with the analysis we are doing at the moment, and my research focus is to look more at the data with artificial intelligence methods to understand how we sleep, and both in the physiological way, but also what is pathologically in sleep with these novel techniques.
Tell me more about sleep from your perspective, from the science perspective.
All these, let's say, 8 hours of recording that happen in the sleep lab are divided into 30 seconds chunks, and then we have some technicians, some experts technicians who look at these 30-second chunks, which we call epochs of sleep, and they look at the patterns that they see in the brain waves, which is called electroencephalography, and then in the eye movements that we measure with the electroculography, and then also in the muscular activity with the so-called electromyography. And they look at the patterns that they see there. And since 1968, we have a way to understand and to score these different epochs. So we can see, for example, wakefulness, and this is characterized by usually complex activity in the brain, high muscular tone in the muscles, and also eye movements typically of wakefulness. And then after wakefulness, the first stage to go into sleep is called N1 sleep, which is the first stage of the so-called non-REM sleep. And then there is N2 sleep, N3 sleep, that goes from lightest sleep to the deepest sleep. So N1 is the lightest, N3 is the deepest sleep. And these sleep stages are characterized by different waveforms in the brain waves. For example, these brain waves become slower the deeper the sleep is. And then we go into REM sleep. REM sleep is characterized by these so-called rapid eye movements. This is why it's called REM sleep, rapid eye movements. And it's the typical part of sleep when we dream. And we have this sequence of N1, N2, N3, and REM sleep about 4 to 5 nights during the night. So during one night, we can see this evolution of the different sleep stages in the patients. And so we see this sequence of different sleep stages. So this is what we see in the sleep lab for the patients. And as I told you before, this is the way in which sleep is analyzed by now. But you can imagine that essentially sleep is more than that, in the sense that just categorizing 30 seconds as only one sleep stage is quite reductive. And therefore, with these novel techniques, we try to understand if there is more complexity into just wakefulness or in the different sleep stages. So we are trying to understand more, try to get a way to understand sleep which is not so simplistic as just these 5 sleep stages, but to understand more because we see more actually in the waves.
And what is sleep disorder? Is it something that happens during one of those stages, or it can happen anytime during night?
When we talk about sleep disorders, we have to refer to some international classifications. There are up to 80 different sleep disorders. So this shows how complex the field of sleep disorders is. And some sleep disorders occur only in some sleep stages, other disorders occur during the whole night, during all the different sleep stages. One sleep disorder which I've been focusing a lot my research in is so-called REM sleep behavior disorder. And this REM sleep behavior disorder occurs during REM sleep, so the phase of dreaming. So this is a specific sleep stage, the specific disorder which happens only in REM sleep. Other sleep disorders, which is called, for example, this sleep apnea, which is stopping of the breathing while sleeping, occurs actually during all the different sleep stages during the night.
How the sleep research, for example, your research, advances medicine, sleep medicine?
The sleep research is for sure advancing understanding. It is, for example, as we already talked about, this REM sleep behavior disorder was discovered in the 80s, and since then we discovered a lot about this disorder thanks to research. Of course, there is all the pharmacological research which is changing sleep understanding and treatment of sleep, but if we go into the technological field with the artificial intelligence, we are, I think, at the beginning of this changing. At the moment, for example, as you can imagine, this scoring of sleep stages is quite a tedious work because a person has to look with the eyes at these different sleep stages.
So it's manual?
It's manual. It's a manual process which takes quite a lot of minutes and it's tedious and requires a lot of concentration. If all the different things that you can score, not only sleep stages, but if you consider also apneas or micro awakenings, which are called arousals, which happen during sleep, it takes essentially up to 1 hour to score one entire night. So it's for expert scorers. For less expert scorers, it can take also 2 or 3 hours. So you can see it's really a long process with a lot of manual and visual work. Artificial intelligence, on the other side, is helping or has the promise to help this. By now, there are quite a lot of applications, quite a lot of algorithms which researchers have been developed, which can score sleep stages as good as humans, or in some cases has been shown even better than single humans. And however, we are at the moment at the point in which research has shown, okay, we can do that, but we need the next step, integrating this into the clinic. So far, we are not integrating this into clinical work. So far, the use of artificial intelligence in sleep research, in sleep medicine, is at the door, let's say, waiting to enter the clinic.
If I go to take a sleep study as a patient, there won't be any machine learning involved in analyzing the data.
There are some softwares which already include machine learning to analyze the data. However, there is always this human supervision involved, meaning that technicians revise this. And this is because so far, none of the algorithms for sleep staging, for example, has been approved to do that. So we are waiting also for some regulatory frameworks.
So AI can help doctors to evaluate the results. Is there any other area, any other aspect that AI could be helpful with?
Until now, we talked about the sleep scoring, so identifying specific events, sleep stages, apneas, these arousals, or, for example, movements. However, there is also some more understanding and some more research to see if we just give the polysomnography as it is, can we identify directly one sleep disorder? So not looking just at the single events, but can we see different sleep disorders? And this I've been doing, for example, with REM sleep behavior disorder. I've been developing some research algorithms that showed promising performance to identify patients with REM sleep behavior disorder. So we can start really also to diagnose just by giving the entire sleep data to an algorithm. We can identify sleep disorders from the data. However, as I said, this is still in research and is not used in the clinic.
And coming back to polysomnography, which part of this process, let's say, would you improve with AI first?
I think we will see two developments in the next years. Polysomnography will remain because it's required for many sleep disorders. The first part that will change is for sure the use of AI to do sleep staging. At the same time, there is another evolution of technology which should be taken into account. Polysomnography is an examination which also requires a lot of cables. I mean, it's not wireless. It's patients sleep with a lot of electrodes attached to their body. So the next step where technology is coming into is to make the recordings lighter, to allow to record brain waves and eye movements and muscular activity with wearable technologies, patches, or some other devices which are for sure more comfortable for the patients.
The sleep study uses 20 plus channels. I don't know how about your sleep lab in Innsbruck is.
Yes.
How many? It's
Yeah,
more than 20.
More than 20, yes.
Do you think, maybe it's too futuristic question, but do you think we could focus only on one channel, on one specific channel, and let the AI find the nuances and the patterns in this one single channel? And do you think it will be enough at some point in the future to detect, well, maybe not all the sleep disorders, but let's say one of them?
I think there is a lot of promise in looking at less data. However, I'm not very optimistic in using only one channel because the sleep disorders are quite complex, and to maybe as a screening tool this could be useful. However, for good characterization of different sleep disorders, more channels are needed because patients are very complex and there is always a lot of things to take into account. So I think for the future we will have still quite a lot of channels because they bring complementary information to each other. And so this is the way that I see it.
There are channels that are more important than others and carry more information than others. Is that so, or this is not true?
It depends what you are looking for. For example, if you are evaluating a patient who has a lot of movements, of course, in this case, muscular activity is very important. If you are focusing on a patient with sleep apnea, then the respiratory channels are more important in that case. The problem is when you have a patient with a complicated history and you do not know where the problem can be, then you need all the channels essentially. But yes, of course, if you have you already know the conditions of a patient, you want just to do a check on that, then might be possible to focus on less channels, yes.
Polysomnography is like holistic kind of study, right? It records so much data. And is there anything more, except sleep disorders, that it could show, it could point?
We can predict age from sleep. It's possible to get this so-called brain age index. And this brain age index is the difference between the predicted age of the artificial intelligence algorithm and your age. When the model predicts higher age than one actually is, it has been shown that this is correlated, for example, with disorders, like, for example, hypertension, diabetes, or dementia. So this is shows how polysomnography, being so complex, can give us quite a lot of information extra. And so we can understand actually the status of the brain. Or we have shown also with a recent paper from our lab, the first author is Dr. Abubakar Ibrahim from our sleep lab. We have shown, for example, how we can predict from the polysomnography with the different sleep structure, development of any kind of neurodegeneration, dementia, Alzheimer's disease, Parkinson's disease. So polysomnography has information about many things. Many studies have also shown how sleeping bed, showing that one sleeps bad in the polysomnography is related to later development of cardiovascular diseases, Alzheimer, Parkinson, and so on. So this is very important. Sleep studies contain really a lot of information that we should exploit more.
So it's comparable to scanning the patient and getting so much information.
Yes, absolutely. Sleep is so complex, and for many years it has been somehow, not really taken too much seriously. But actually, what happens during sleep is incredible. The brain is so active actually during sleep, and this contains a lot of information which is very useful to understand better the patients.
Are there any specific machine learning techniques that you find particularly valuable?
As for every field, I would say deep learning by now became the standard for analyzing also sleep data. Imagine that one night of recording, it's about 1 giga of data. So this is really a lot of data. And of course, deep learning and with the supercomputers we have at the moment can really understand better and work better than classical machine learning to analyze the sleep data. So deep learning is the current standard, plus the fact that different sleep labs started to share their data, so that we are starting to have thousands, even sometimes hundreds of thousands of recordings, all together with these deep learning algorithms allows us to understand better and better and better sleep. And so I think this is the standard deep learning, and I think for the future we'll use a lot of deep learning. We use so in the deep learning we have a lot of different techniques. At the beginning was quite a lot of convolutional neural networks, because the different signals could be transformed into images, and then these images analyzed by convolutional neural networks. Some others attempted with the recurrent neural networks, so with the LSTMs, so because of the temporal relationship. But also, especially for sleep stages and other aspects of sleep research, transformers are also coming in. So the transformers, which are the base of ChatGPT, just to make it clearer, they've been applied also in sleep, and they are showing also good promises in sleep analysis.
Do you remind some example of project that advanced the sleep research recently?
Concerning sleep stages, I think one big milestone, a recent milestone, was a paper from 2018 from the Stanford group, where also the Sleep Lab of Innsbruck participated, in which it was proposed a novel way to look at sleep stages, looking essentially at every 30-second epoch, not just as one sleep stage, but actually as a mixture of all the sleep stages. And in this way, essentially, what was considered, let's say, this page, this 30-second epoch is wake, is actually, with this novel algorithm, seen as, it's maybe 60% probability wake, 20% probability N1, and then some probability N2, N3, and REM sleep. So this way of looking at sleep stages is a little bit more realistic, because as we talked before, you are not in one sleep stage for 30 seconds exactly. It's always a mixture, and sleep is a continuous process.
Hi, Roel here from Amsterdam. I'm curious about what's your biggest health advice which you would give someone. What would be the number one takeaway if you could give only one advice to a person to increase their health?
Have a good sleep. This is very, very important. Actually, it's productive for your life, I think.
But how to get better sleep? Do you do something for yourself to improve it?
Try to keep regular sleep. This is something that I do for myself. And just to give time to sleep. Just to say it's a thing that makes me feel good, so I should do it.
You mentioned wearables. So now I would like to talk a little bit about that. wearables as the devices we have already at home, or devices that you rent from doctor?
What we have at home at the moment are fitness devices. They are not clinical devices. This means that we can use them, let's say, for fun to track our sleep, but they have not been validated, most of them, for clinical diagnosis, for clinical applications. So it's always good to have a critical eye on what the different apps, the different wearables give you as an output. Some of them give outputs which are also not clinically meaningful. For example, the so-called quality score of sleep. Many apps they give that there is not something relevant in sleep medicine that correlates to that actually. So we have to, I think, work better as a scientist with these companies to produce results and produce apps and wearables which can be also more useful for clinicians.
And what role AI would play here?
The best thing that AI can use here is the quantity of data. Compared to polysomnography, the great advantage of wearables is that you can track sleep every day essentially, because they are so light to carry and so comfortable that we can have a lot of data. And therefore AI can use this great quantity of data to get probably as precise results as one polysomnography in the future. But we are still not there. And as I said before, the two worlds should come closer to each other.
I tried once myself a wearable. I won't mention the name, but it was kind of giving the stages, and I could see when I was awake, when I had a deep sleep and REM sleep and so on. Is it kind of accurate, or?
Depends. There are some which are more accurate, some which are less accurate. So we have really a lot of range in between here. Of course, the ones which are more validated are typically more accurate, but there are some which have never a validation against polysomnography, and therefore you do not know how they work essentially.
Is there any chance that in the future the wearables could overtake polysomnography, or this is science fiction?
For some disorders, I think they could. For others, like as we talked before, REM sleep behavior disorder is such a complex disorder which requires really careful investigations by doctors and technicians. I think in these cases they will remain, polysomnography will remain. But I think there will be a shift towards integration of both somehow in the future.
Yes, and before this conversation I was kind of leaning towards thinking that polysomnography will be less and less popular and this new AI wearables will take over. That was my impression, but you said something that polysomnography has potential to give an overview of the general health and some other insights about different aspects than just sleep disorders. So I think this direction, this seems like a huge potential for polysomnography, and I think now it will grow. So it changed my mind completely.
Maybe recorded with different technologies than now, but I think it's important to keep it as comprehensive as possible. Yeah.
Now let's imagine that you have unlimited resources. Would you rather focus now on improving polysomnography, or rather you would focus on inventing a new sensor that would allow a new way of testing? That would be like at home, high performance, real-time, cheap, contactless and accessible.
Yeah. If I would have unlimited resources, I would invent a way to record polysomnography at home. Because then we have a lot of data, so with new sensors.
Merging.
Yes, exactly. Yes, that would be a great dream. Yes.
Okay, I would like to talk now about sleep and respiration. Is there anything you observed during your researches that relates to respiration, or this is totally out of your scope?
So I've never been working a lot with the respiratory signals. I am reading what's happening in the field, but I don't have personal experience with hands-on in respiratory signals. Also here, there is a lot of developments of deep learning. And also here, respiration is not only sleep apnea. There is a recent paper in Nature Medicine showing that just by looking at respiration during the night, they could diagnose or identify patients with Parkinson's disease, just looking at respiration. So how one breathes during the night is a biomarker of a neurodegenerative disease. There is, of course, apneas are very important. A lot of people suffer from sleep apnea, but respiratory signals also offer something more.
As you said, signals, because respiration, it's there are many parameters like chest movement, just airflow, and of course the rate, probably something more.
Mm-hmm.
So it's not one thing to be measured, it's more complex.
Yes.
We talked before privately about the project I'm working on. It's related to detection of obstructive sleep apnea. And considering your background, do you see any potential application of AI in this area?
Yes, absolutely. There is a lot of potential because there is some research already showing how from respiratory signals with deep learning is possible to identify quite well sleep apnea. So I think this is absolutely something that it's important for the future, and there is growing evidence showing that deep learning can identify sleep apnea patients. So I think it's and even give more information, because also in the field of respiratory sleep research or respiratory sleep medicine, we always look at one index, which is the so-called apnea-hypopnea index. But is this enough? So also this, I think, as the sleep stages, it's a little bit too simplistic. And there is more evidence showing that actually sleep apnea is not just the apnea-hypopnea index. It's quite more complicated. And again, I think if we look more at the signals, we can get more insight into the sleep disorders and understand them better. And deep learning, I think, offers a big promise into that.
So to put it more simple, you say sleep apnea is not only stopping breathing during sleep, it's more than that.
So it's also other things. For example, this apnea-hypopnea index counts how many sleep apnea and hypopnea, which are, let's say, less severe apneas, to make it easy, occur during the night per hour of sleep. However, other informations might be more important. How long are these sleep apneas? How severe is the awakening that you have afterwards? How severe is the drop in blood oxygen that you have during the night? And these people are starting to look at these and see actually that these index counts. So, for example, how severe the blood oxygen drop is a very important aspect. It's not just only the apnea itself, it's also all the physiological part related to the apnea, which plays a role in understanding better the disorder.
I understand. Of course, I agree totally, but maybe I also simplify too much. But if you stop breathing during sleep for longer than 10 seconds, I guarantee you this will influence your blood pressure and it will influence your oxygen in blood. And do we have to still measure oxygen and the pressure if we know that for sure? Because this will happen.
As a screening technique, I think it's very important, but there is more evidence on the treatment side showing that one has to understand a little bit better what's happening to give a better treatment to the patients. So I think it's a screening tool, looking at there is apnea, there's not apnea, is great, but then for treatment point of view, it's important to understand it better, understand how severe this is, and this is not just the length of the apnea, but it's also many other physiological parameters.
the small positive things which are around you every day. Get energy from them.
How do you think that artificial intelligence will change your life?